I'm Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. And this is my wife.
Hi, I'm Dr. Jennifer Sue. I'm a private practicing OBGYN. We're first going to go through the top 3 things that women should know about low libido.
I'm going to be talking about the top 3 things men need to know about women's libido.
I'm really glad that my husband is going to address the top 3 things that men need to know about women's libido because it's coming from a man's perspective. And before we start all this, we want to make sure that you know that there's some sensitive topics that we're going to talk about, so they're probably not appropriate for young children. So if you want to get them busy in another part of the house, that would be a good idea to do. Low libido means that we just are not horny enough, we just don't want sex like we used to, or we just have never had an orgasm or never wanted to have sex. The most common concern I see in the office is that the husband or the significant other wants more sex than the wife, and their concern is that the husband is grouchy, the husband wants more sex, and they just really are not in the mood. Some people just have always had a low sex drive, some people have had a higher sex drive. For the purposes of this video, this is for people who are just wondering why their sex drive has gone or is just extremely low. The top 3 things that you guys need to know is first thing is check it out with a doctor. So you're wanting to know if anything's medically wrong or psychologically wrong. The second thing is it a husband or partner issue? And the third thing that women should know about a low libido is it between our ears? Is it just something that we do ourselves to cause it?
In other words, is it normal for some people?
Is it normal for some people? From a conventional medicine point of view, you want to go to your doctor and they'll ask you things like, does it hurt during intercourse? Because if it hurts during intercourse, you're just not going to want to have intercourse because the brain remembers pain. And if it's associated with sex, they're just not going to, the body just will not respond. So they'll probably do a pelvic exam and maybe even order a pelvic ultrasound to see if you have just a variety of conditions. It can be adhesions from a previous surgery internally. It can be vaginal scarring from previous childbirth. It can be endometriosis, ovarian cysts, uterine problems with uterine tumors causing pressure in different parts of the pelvis so that when the penis goes in the vagina, it is physical pain. It could be infection that causes any kind of pelvic pain, or anything psychological that could cause it. Was there any past sexual abuse, even from childhood or past sexual trauma? And this, if I get a positive answer about this from a patient, I don't delve into it because this is a subject that's handled by a psychiatrist that specializes in sexual abuse and past sexual abuse, because when this happens to a woman, their emotions and feelings about the violence is very difficult to handle. So if this happens as a child, all those emotions are kind of pushed down and then locked because a child just can't deal with those kinds of emotions at the time of the violence. So then what happens as an adult is it starts to bubble and bubble and bubble. And if that woman hasn't dealt with it, it sometimes shows up as low libido. And it's very interesting, some of our patients who were sexually abused at age 3, when they've gone on to have a child, when that daughter or that son turns 3, suddenly their libido went away. And I'll send them to psychiatrists specializing in sexual abuse counseling, because if a doctor is going to bring that stuff up, they really need to know how they're going to help you deal with all those emotions and all that pain when that thing is unlocked and all of it comes out. Doctor will also ask you about what medications you're taking, because some medications can cause a low sex drive as well. Some examples are some of the antidepressants. Wellbutrin SR has less sexual side effects than some of the other ones.
And some high blood pressure medications too.
That's right. Third thing that a doctor may do during this medical workup is just really check your hormones. In our practice, we use saliva testing because that's just how I was trained. Some other doctors will use blood testing. So it can even be thyroid hormone too. Second thing that you'd like to check out if you have low libido is find out if it's a husband or partner issue. Like, just check out your relationship. You know, my husband here, when we were dating, we knew we were both physicians. He said, you know, we're going to have to be creative with how we spend time together. Remember you saying that?
Yeah, I did, because they were so busy. Still
Because
are
we
now.
are both so busy, and you don't have to have a date night. You just have to spend time together. And so he'll take me to the hospital and make rounds. He'll be with me doing different things because he just wants to be with me and to find out what's going on in my life. Because if you don't, you do start drifting apart. And like he's always said, sex is between the ears. And for men too. Sex for him and when we make love is something between us as a relationship, and it's just like icing on the cake. If you don't have the cake, it's kind of empty. And every morning he just cherishes me, and he doesn't kiss me sexually all the time, like just kisses on the forehead all over my face just to know that he loves me. And so what's important is, no dad, seriously said don't do that, because he said it's good that I do that, so then it just makes you look like you.
Okay.
And so what's important is for a husband like him to really spend time with his wife, cherishing her and telling her wonderful things about why he fell in love with her to begin with. And verbally, women need that. And so when it comes time to having sexual intercourse, it's a lot easier for me to respond because he's spent that time all week spending time with me and knowing, how was my week? You know, what's going on next week? What things am I worried about? Third topic that women should know about their low libido is, where does that stem from? And that's where an integrative approach really comes from. What was your background? What was your religious background? Was being horny bad? Was having an orgasm bad? Was a woman who liked to have sex considered sinful or bad? So you may have grown up in an environment where being sexual was considered bad. You may grow up in an environment where if you were caught masturbating or doing something like that, it was considered bad. And so you have to look back at your past. What did your family kind of passively pass on to you? Because some women feel that it's very bad for them to like sex and to show that they're enjoying sex. And share it with your partner or your husband, because then they get it. They get that when they're doing something right with intercourse, you're actually enjoying it, even though you won't say it. So that they kind of know where you're at. Forgot another thing on the third thing, whether it's up to us. Women and men are very different with sex. So for a man, if they want to have sex, it's very linear. If they want to have sex, they get horny, the erection happens, and they're ready to go. They can have the house on fire, they can have a pet barking, and they don't hear any of it. They're having sex, and that's all they think about because their mind is linear. Women's minds are circular. So everything on the outside of the circle is everything in their lives. Their house, their kids, their family, the kids' friends, the kids' principals, the kids' teachers, what the kids are needing to do the next day, what they're cooking for dinner. Anything they're responsible for in their lives, if that is all perfectly okay in that circle, their sex drive is complete and good. If anything's outside of that circle, their sex drive is going to drop a little bit, and you add on more problems with health issues, kids being bullied at school, and they're worried about that. So their sex drive starts getting buried under all those things, and their circle's all out of shape. To ask your husband how to help you with things. Not only is his verbal affirmations and everything important and the touch throughout the week, but ask him to do things like, so don't wear yourself out. Give your husband something to do at home. When we used to have Baby, our ferret, her cage needed to be cleaned quite often, which if you've ever owned a ferret, they're very messy. So he said, you want me to clean Baby's cage? I said, okay. So he did it. He went up to bed, and I remember looking at it going, wow, that was a horrible job. And I never told him this. That was a horrible job. It looks like nothing was done, but I didn't say anything. I said, thank you, Jack, for cleaning the ferret cage. And then I cleaned it up, of course, for Baby's sake. Cleaned it up, didn't tell him that I redid it. Would you believe he did it again? Because I gave that verbal affirmation that he did a good job, even though he didn't. Then he did it more, and he did, and actually he became an even better ferret cage cleaner than me by the end. So give your husband a chance to do things around the house. Even if the first time he does it looks horrible, give him things to do, because men like to help because they know women are multitasking. Sometimes it's our own fault that we're so exhausted. As I've counseled women, I've come to know this is really true. Sex for a man is how they feel close to their woman. There is no other substitute, because no other person can do that with their partner. And so for them to be emotionally close to us, they need that sex with us. For women, some women need that too. For me, I don't need that, but I know that he needs it. So if you think on that train of thought, if you two are okay, guess who's going to be fine? The kids at home. Because the kids need to see that their parents are okay. Then if their parents are okay, their world is just fine. They can be hungry, they can be bullied at school, they cannot have good clothes or new clothes to wear. They don't care. They see their parents touching, holding hands, loving each other because they've had sex. So libido is so important for the family unit. There was a comedian that said the girlfriend or the wife moved in first to the apartment, and she set up all of her signs that said, live, laugh, love. Live, laugh, love. Signs everywhere. He said, all men need is sex, sandwich, sleep. Sex, sandwich, sleep. And I think that says a lot. And I think that as women, the husband or the partner should be the priority, not the kids, because they are your team member. And you can do anything for 5 minutes for the kids. Sex may be longer for you, maybe not. You can do anything for 5 minutes if it's going to make the kids' world okay. Less pissy, they do a lot more around the house, and they're easier to live with, because if you don't have sex enough, the partner gets kind of pissy, and it's even harder to want to have sex with them. So those are my top 3 things about women and what they need to know about their own low libido. And to share your stuff.
Yeah, so there's 3 things that I think all men should know. And like Dr. Sue mentioned, is that in our program we learned to focus really on the whole patient. And there's 3 things really I think guys really need to understand, and they probably know this already. Number 1, the whole act of sex and getting ready for sex for us is a physical thing. And for women, it really is an emotional thing, and there's a lot of things that go into it. And as you probably discovered, there's history leading up to the event that can impact how that episode of intimacy happens. Number 2, understand your spouse or partner's cycle, and everyone has
menstrual cycle.
And even for men, we have our different cycles. We're more grouchier at certain times of the month than others, and that's just, everyone has that. But just be clued into that, especially when you think your mate is going to be on a certain stage in their cycle, that there's a good and bad time to really start to initiate sex.
He's talking about PMS.
Yeah. And number 3, really listen to verbal cues. I think oftentimes men just go about their business, and we're very goal-oriented, task-oriented. And sometimes we don't really stop and listen. And if you really pause for a minute, understand what your partner just said, then you're going to miss a lot and maybe just blow the whole opportunity.
You know what's so interesting is we weren't married very long, and you already knew what times of the month I was more apt to want to have sex or hornier, in other words, certain times of the month. He already knew because he studied me, because he loved me. And I love that about you.
Thank you.
So if you have any comments, please put them in the comments below. We love discussion, and we love how you all can share with us and with the community on what thoughts you have. What will be our next topic next week?
I think next week we should stay on women's health, because we're going to have a few weeks on bioidentical hormones.
You all want to do
great.
bioidentical hormone therapy? All right.
Thank you very much for joining us.
We'll see you in our next video.